cancer there? So don't let no doctor say, just because you're menopausal, you don't need a pap smear, you do. And you need to get checked out. Do we have any questions about that? I know I only have a little bit of time, so I just want to make sure you know that you need to get checked out, whether you had hysterectomy or you still have everything. Now just say you don't have a hysterectomy, because I see a lot of older women here, and you still have your uterus and you still have everything. So the older you get, the more dangerous it becomes. So if you still have your uterus and everything, you should never, and understand the words coming out of my mouth, you should never spot. You should never bleed. Because what's happening is that your uterus is building up abnormal cells, and that's called hyperplasia, and it's starting to shed it, like if you were on your cycle, but you're not on your cycle, okay? So we would have to do what we call an EMB, that's an endometrial biopsy, and that's done in the office. And most of the time it doesn't, but I can honestly tell you, in my private practice, to get checked out. Or if you're having bleeding, dysfunctional bleeding, that's called DUB, uterine bleeding, you need to get checked out. Any questions about that? You gotta take care of your box, okay? Because nobody else is, okay? You really do. There's only one of you, and you're beautiful, and you're all you need, okay? But you can only take yourself so far. I know it's a scary situation, and some of you guys probably had a really bad time with some GYNs. I can guarantee when you come to me, because look how I'm dressed, okay? You would never know I do what I do, okay? But this is who I am. You know, I don't need a white jacket. I don't need a lot of letters behind my name. I know what God gifted me, and I know what I should do. I promise you'll be relaxed. Okay? Now, breast exam, okay, that's high, okay? I think in Trumbull County, I shouldn't say this, but I think with the mills and everything, we have a high population of breast cancer in Trumbull County and Mahoney County, very high. The youngest I took care of, I think she was 19, she died of breast cancer. She died right before she was supposed to graduate from Kent State. And I think, to me personally, on the research, a lot of young people take their phones and carry it inside here. Because she had the most advanced form of breast cancer. Okay, so it's on the rise. And for some reason, when a younger person gets breast cancer, their mortality rate is much higher than older people. I don't understand that, but it is. So this is what you want to look for when you do when you check your breast. This over here is called the telesphere. That's where most cancer happens at. So you really definitely got to check over here. That's where most masses are missed, or lumps are missed. Okay? You want to check your breast in the shower first, okay? With your hand above over your head. You want to check it, because when the water hits it, that's when your breast is most sensitive, okay? You want to use your 3 fingers, and you don't want to go hard, because if you press it down hard, you're going to miss the lump, actually. You're going to move it. So you want to go like, not a lot of pressure, just kind of light to medium pressure. In a circular motion, okay? You want to do that in the shower. Then when you come out of the shower, this is very important. You want to look in the mirror, because your inspection is going to be the first. It's going to come, because there's 2 major type of cancers that I usually see in my practice. You want to look at it, okay? You want to see if there's any change in size in your breast. Now, one breast is always going to be bigger than another one, but when it's so obvious, you know something's not right. And another thing you want to, I don't know if you can see it, but you see that dimple that I have? You ever see a dimple on people's smile? You should never see that on your breast. If you see that dimpling in your breast, that is called a retraction. That could be a tumor pulling it in. That's how come they tell you look for any dimpling. And here's another thing. If you see any rashes or patches on your breast, and especially, I know people don't know this, if your breast starts to itch at night, or itch a lot, That could be inflammatory. That means the carcinoma is going up in the ducts. Your breast itch, that is something you need to see your GYN for. So once you inspect them, when you lay down and you put that pillow, you're gonna put the pillow up under the breast you are checking, because it'll even out the breast tissue. Now I'm gonna tell you how I teach my patients how to check. When you're driving down in your neighborhood or you going to work, don't you notice different things about the neighborhood? Like if they tore down a building, or if someone painted their house, or you see somebody walking, you know about it, right? This is your neighborhood. Your breast is your neighborhood. You check at the same time, the same date, every month. Now, if you're on your cycle, you don't check it until 6 to 10 days after, right? Because they get tender, they swell. But listen, this is your neighborhood. So when you check your breast, you can say, whoa, that wasn't there. That's not there. That wasn't there before. Then you know something's wrong. Because cancer just don't show up in a lump, right? It just shows up where something feels different. So you check your neighborhood at least once a month. And you get into us as soon as you can. So either I'm gonna do two things. If you're over the age 40 and over, you get a screen. That means that they just gonna screen and look for anything that could be different. Now I do like the one next to downtown Youngstown, because they do 3D and 4D. So they do check for the ones that come above the skin. That's where I send my patients to. Okay, that's a screening. They're just gonna look for the basic. And I send you to the same place all the time, because then my radiologist who calls me compares what you did from 1 year to the next year to see if there's any difference. If it's a diagnostic, if I feel something, I'm gonna do a diagnostic mammogram. That means they're not gonna do a screening. They're gonna go right in where they said that I felt it at, was 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock. And they're gonna do ultrasound on top of that. And then if they find something there, they have 2 doctors that are always there. They're gonna call you back before you even leave the building. Before you even leave the building, and consult what to do. Have any of you ever been to the one downtown next to, it's beautiful. They have waterfalls. You act like you're in a spa. It's very calm. So you have somebody who will be there with you, who will talk to you, who will tell you about their procedure, everything, because they're gonna get it in, because the sooner they can get that out, the better. No, do I argue with them? Sometimes, yeah, because sometimes they'll come back and go, oh, it's benign. How do you know it's benign? Now with ultrasound, I was like, take it out, right? Why should we wait till it gets bigger? So I do go back and forth with them, but it's okay. I'm not everybody's cup of tea, but I don't like tea anyway, so I'm okay. My whole thing is taking care of my patient. I'm not trying to win a popularity contest. My job is to take care of you. So if you go, you don't have to come to me, but whoever GYN you go to, and they check you, and they're in and out in 2 minutes, they did not do their job. Know that. Because they should be up to, I ain't saying they should make camp, okay? I'm just saying, they should be down, and they should be looking at it carefully. They should take their time with you. Because when I see my patients, when they come in, they are not to be undressed. My nurses is not, because how many times have you went and got to a GYN and you're naked and you have that little thing in you and you're like, and they're asking you all those questions. And you're just like, just do what you gotta do. So I go in and talk to you first. I wanna know about you before, you know, because I'm gonna be all up in your business. Okay, so I think I should introduce myself first. So I'm gonna talk to you, I'm gonna ask you questions. One question I do ask, and you might feel like I'm being too much in your business, but I have to, so I can take care of you. I'm gonna ask you how many partners you've been with. Have you ever had any STDs, okay? Which is on the rise in Trumbull-Mooney County. It is on the rise, okay? I'm gonna ask you if you've ever been raped or sexually molested, because when I check you, that might trigger something, right? So I'm gonna be very sensitive to your needs. So, and I know we have older women here, but I do want to say this, STDs in Mahoney and Trumbull County is at an epidemic stage. I passed out antibiotics for these diseases like it was trick or treat. And this is really gonna surprise you. It's mostly with my senior citizen, older people.
Why?
The young people, you'd be like, oh, okay, I get it, but y'all know better, okay? I'm just saying, but it is. But if you ever do get one of them, I want you to remember, it is something you have, it is not who you are. Because whether you marry, I probably pass out just as much or diagnose someone with STD that's married than I do people who are not married. So before you judge someone who has it, keep your stones in your pocket. You know? When he said, remember when they tried to tell Mary Magdalene, when they sat there and said, oh, you know, let's stone her? And he just drew something in the sand and said, you know, those without sin cast the first stone. And everybody, I always keep my stone. And matter of fact, if you come see me, I guarantee you, you'll see a little bulge. I keep pebbles in there that my church gave me when I went on a retreat. So every time I think my bias, because I'm only human, right? Sometimes your bias kicks in. And you're like, oh my gosh, she just had an libation. You know what? I put my hand in my pocket and I feel the stones. Because God said, those without sin cast the first. And that brings me down. And then he takes me through this quick thing of how I used to be, and I'll be like, I'm good, okay? I'm okay. So if you ever have that disease, or you ever catch an STD, please don't make people make you feel bad. It is something, no one wakes up in the morning and say they want that, right? It can be treated. That is what you have, that is not who you are. Okay? And I will take care of you, and the way I write the scripts, I encrypt it. Well, even the pharmacists don't know what you have. And sometimes I treat you right there. I'm Meridian, I treat you right there. I make you take the medicine right there. All right? But the best thing is just to know your worth. I can give you all the pills, I can take care of you, but each time you get an STD, you get a chance of getting HIV because your immunity drops, which a lot of people don't know. Your chances of HIV goes up or again. I don't want to walk in one day and not have a script for you. So I know we're in church, but let's face it, you can't stop people from having sex. And really, it's really not anybody's business, right? To who you have it with. But it does become my business when you act irresponsible for it. When a simple thing you can do is just, I say put a raincoat on it, okay? Just protect yourself. And know your worth. No, I know I left the best for last. I know nobody wants to hear about STDs, but oh well.